project lead End PPH Initiative that's aimed at addressing the issue of postpartum hemorrhage, which is excessive bleeding after giving birth. This initiative was conceived in 2024, and we had 4 main strategic pillars: doing advocacy and community engagement, research and reskilling and training of healthcare workers, innovating within the healthcare systems to improve maternal health, and finally strengthening the data ecosystem. One of our flagship projects under advocacy and community engagement was the initiation of the inaugural run on 6th of October 2024, and we had the second run this year on 28th of September 2025, where we had a successful run, over 15,000 people participating, not just in Nairobi, but across other 7 counties in Kenya and 5 other countries in Africa. So this movement has truly become global, and as a result of this, we've also been able to engage the communities to just know about postpartum hemorrhage and the dangers of postpartum hemorrhage for our women and our families. So one of the pillars that we were really following up was the issue of blood donation. Out of the 10 women that die because of bleeding, 4 of them died because there was no blood for them to get transfusion. So we conceived an idea of having a roaming blood donation, where we are not waiting for people to come to donate blood, but we go to the people and have an outreach for them to donate blood. We had this started on just around the run period on 22nd of September, and went on until 2nd of October. We reached people in Eastlands, at the medical school, at the University of Nairobi, at the College of KMTC, and in a period of 10 days, we received 875 units of blood going into saving our mothers from dying from postpartum hemorrhage. This is a huge success compared to other similar initiatives. We seem to be a group that has done a largest blood campaign program, receiving 875 units of blood in a very short period of time. We are now at a very much of inflection point to scale this idea to the next level, so that we get enough blood for our mothers and then make sure that they do not die because of bleeding. Of course, this blood can also be used in other cases of medical emergencies, such as trauma and accidents, and so that no patient really dies because there was no blood. So it's been really, really successful, and we are very happy. This initiative of roaming blood bank and the End PPH Initiative Run for Her was featured at the FIGO conference. This is a conference of all the gynecologists and obstetricians in the entire world. 6,500 people participated, and I was lucky to give a keynote speech on our experiences in terms of advocating against postpartum hemorrhage and having these new platforms for people to donate blood. Within the same conference, we also had the launch of new guidelines for managing postpartum hemorrhage, and this launch was led by our very own Professor Kihara, and it was an initiative of the World Health Organization, the International Federation of Obstetrician and Gynecologists, and the ICM for the midwives. So we came together and aggregated and consolidated all the guidelines that have been there before into a singular guideline aimed at improving the management and addressing of PPH. One of the key elements that were really outstanding within that guideline is the reduction of the amount of blood to be lost, so that a woman is defined as having PPH. It changed from 500 mils of blood to 300 mils of blood. So it means when a woman just loses a little amount of blood, that 300 mils of blood, we quickly initiate PPH management protocol, what we call the emotive bundle, so that she does not suffer the consequences of bleeding excessively. And this is very important. It means we'll be able to recognize mothers who are bleeding early enough and institute care early enough. And of course, one of the things they also introduced in the guideline is that we should not be estimating the blood loss. We should actually be accurately measuring the blood loss. So instead of saying, oh, we think this is 500 mils or 400 mils, we have to accurately measure that. And what therefore this means is that, going forward, the healthcare professional, the hospital, will be put to task if they do not accurately estimate the amount of blood lost by the patient. Of course, we have also introduced that the midwife should be given a more advanced role in managing our patients, because at the point of care, most of the time the patients will be cared for by the midwife. So we want to give them latitude, some freedom, and of course in consultation with the doctors, then they should be able to address the issues of PPH. So these guidelines are going to be cascaded from the WHO to the Ministry of Health guidelines. So we hope to see in the next few weeks the Ministry of Health revising their own guidelines on managing of postpartum hemorrhage, considering the new initiatives and protocols that have been given by the WHO to better improve the outcome of the patients. So we're really looking forward to reducing the number of deaths from excessive bleeding after childbirth from 3,000 that we have in this country to almost nil, so that no woman is lost because of excessive bleeding. And in Africa, we do not want to lose 56,000 women from our families just because of excessive bleeding. So